Hi, welcome to Survivor Chat. I'm Heather Banks, an 11-year cervical cancer survivor, as well as a Survivor ambassador and Survivor's lead advocacy educator. At Survivor, we feel strongly that knowledge is power, and we feel it's important to empower our community of women and advocates, and men too, with information, important information. And that's what Survivor Chats are all about. We are here today to connect you to a wonderful expert to hopefully help you gain some new information and some new insight and maybe even some new perspectives. And to also, if you're an advocate or a Survivor ambassador, we hope that this information also adds to your advocacy and the messaging that you're spreading with your stories. Our topic today kind of revolves around side effects specifically of cervical cancer, and also mainly the treatment that we endure from cervical cancer. And our guest today is Lauren Mansell, who is a physical therapist. She is also a previous Survivor School speaker. She was with us for our Chicago Survivor School. Our attendees loved her, and she had such great information. For women in general, cancer or not, lots of women will find this information helpful, but cervical cancer patients and survivors as well. So welcome, Lauren.
Thank you.
Thanks so much for being with us today. Let's start off with you just kind of introducing yourself, your expertise, and how your work directly or indirectly connects to the cervical cancer space.
Great. So I started in 1999 as a medical and legal advocate for sexual assault survivors, which got me introduced to the area of the fact that we really don't talk about the pelvis, that we definitely don't talk about some of the cultural contexts of pelvic issues. And so I did the ER advocacy for 11 years. And during that time, I received a bachelor's in psych and soc from Northwestern. I worked in counseling, mainly children birth to 21. Went back and received a doctorate in physical therapy. And it was just kind of a happy culmination to end up in pelvic oncology and lymphedema. It's really the patients that I've seen that have brought me here. I am so honored to be a part of our patients' journeys, and it's the patients, it's you guys who we're speaking to that have really brought me the knowledge and the experience, and got me into this work.
It's so important, and I think it's so as women and also patients and survivors, it's a little unrecognized too, the work that I know is out there with regards to physical therapy and pelvic floor. Let's start with talking about our pelvic floors for just a little bit. I know I have always, through my cancer just journey, if you will, I have been amazed at this point, 11 years out, at everything just about our bodies as women that we don't know, right? That we don't know and we should know, and that's important to know. So if you'll speak for just a couple minutes about what is the pelvic floor in general, but then also what would you consider to be the most unrecognized part of our pelvic floor, yet important part of our pelvic floor, just for women, cancer or not?
Absolutely. So I'm actually going to bring us over to some of the slides so you can see. So everyone has a pelvis. We're actually sitting on our pelvises right now. And for me to raise my arm up, my pelvis has to stabilize. So believe it or not, men and women aren't that different as far as our muscles and connective tissue go, which everyone's like, well, Lauren, no, we're way different. From a muscular and connective tissue, we're actually not that different. For women, we have two main groups of pelvic floor muscles. Everyone's obsessed with muscles. So I personally think the connective tissue covering the muscles, arteries, veins, nerves, lymphatics, it's called fascia, that's actually more important than the muscles. But we have two main layers. So there's the urogenital triangle, which is more superficial or on the outside. And then there's the deeper layers, that's the levators, and they go all the the way underneath there. So this is a view looking up from in between the legs, whereas the bottom view is looking down into the pelvis. So this is really showing those levator muscles. Very, very, very important. I really like this view. It shows all of the levators. It shows the urogenital triangle, and then the structures that are going through it. This is all muscles, and over every single one of these muscles, 44 actually, there's that connective tissue, that fascia. So right here, you would imagine the bladder. Right here could be the cervix and the uterus, if it's in someone who hasn't had surgery, and then here is the colon, rectum actually. So as you could see, these connective tissue, I mean, it's just huge and it's so powerful. And there's the mechanisms. There's a 3D function in how the muscles work.
There's so many muscles. I've never thought about that part before. You're right. Everybody is kind of obsessed with muscles and everything, but we never think about the muscles, especially in our pelvic floor, and how many there are, and also how important they are, for sure.
Right. Try to get back to
So so that's a really quick, obviously, rundown of our pelvic floor. Let's talk now about cervical cancer patients specifically, and how does having cervical cancer, but then also the treatment that we go through for cervical cancer, how does that affect our pelvic floor in ways that we aren't usually, as patients and survivors, we're not usually aware of these effects until later on after we finish treatment. Then we kind of start to see and feel these effects. So talk about that. How does this all affect our pelvic floor as a patient and survivor?
Absolutely. So during cervical cancer treatment, which all of you can probably speak more to this than myself, we know that there are the ramifications of chemo, of radiation, and surgery. We can there are different dysfunctions that come from each and every one of those treatments. And there's actually dysfunction coming from the cancer itself. So usually it's kind of based on what your treatment is, but we can look for chemo-induced peripheral neuropathy. That comes from the chemo. From radiation, we are looking for fibrosis, scarring, scar tissue, constrictions that occur. I think I said radiation fibrosis, and the effects of lymphedema. From surgery, we have the effects of scar tissue. We have tightening, weakness, and we also have risks of lymphedema when the lymph nodes have been taken out. And because this is all in our pelvis, we have risks of bowel, bladder, and sexual dysfunction. A lot of times the dysfunctions depending upon the treatment. So this is what we're looking for in this intervention slide, is any kind of weakness that's occurring from the chemo, the radiation, the surgery. Fatigue is usually chemo, but it can also be radiation to surgery. Pain likewise. Scar is usually more of surgical, whereas the fibrosis really comes from that radiation. Radiation, we know, is the gift that just keeps giving and giving.
Oh, yeah, it is.
So we want to look for that tightness and range of motion. The biggest thing, what I'm working on personally is really trying to address lymphedema, because I was honored. I was able to go to France and speak to surgical oncologists internationally, and the surgeons were like, "We just don't understand. We feel like our patients should be happy that they're living, they're surviving." And I literally was like, "That is unacceptable." It was like this really cool movie moment. It's like, it's unacceptable because there are treatments and rehab. A new study just came out. We can prevent lymphedema, right? Like, I can actually say we can prevent it now. And no one's speaking to that. So we're really wanting to come up with this HAT. So HAT for lymphedema, it historically has been kind of really regarded as that swelling. Well, swelling is already stage 1, stage 2. We want to address this in stage 0 when there's a risk of lymphedema. So if there's been lymph nodes that have been removed, or if there's been radiation to the lymph nodes. So HAT is heaviness, achiness, or tightness. The very moment anyone feels one or any of those, that's the time to reach out to a lymphedema therapist and start the treatment so we can prevent that swelling. Really, really huge. And of course, the bowel, bladder, sexual dysfunction that comes from radiation, chemo, and surgery, and then managing our stress levels and making sure that we're sleeping well, which can be, some of these things are a little less identified, I feel like, in the medical regime, but we definitely need to address them.
And they're all very, I mean, we're talking about pelvic floor, and you've mentioned lymphedema, which we're going to get into here in just a second too, but I think a lot of times we might think of them separately. What does lymphedema have to do with the pelvic floor? But they are kind of, it's interesting just how all interrelated everything is when we talk about these side effects. And there's so many of them too.
Right, one of the five main roles of the pelvic floor is lymphatic, is the sump pump. So,
I didn't know. Oh, wow. Okay. Yeah. That's huge.
Super important. Yeah. They're all interrelated. They really, truly are.
Yes. Yes. And just, again, just knowing about it. I went through all of my treatments, like I said, 11 and a half years ago. And I didn't remember, I knew nothing about this until I actually did develop lymphedema, is when I first became aware of it and its connection to, cancer treatment and whatnot. So, okay, before we get a little bit more into actual lymphedema, because I know that's a big topic for our community and also a big expertise of yours, what are some tips or maybe even exercises that you have or that you could easily prescribe? Everyone's different, we know, in terms of treatment they had and what their current situation is. But what are some tips or exercises that women could do? And let me know too if that's good to talk about now, or if that would be better to talk about after we dive into lymphedema. What are your thoughts?
We can do now. So
okay.
I'm going to go over to so we saw the pelvis, we saw the pelvic floor muscles. So more importantly than strength is, I'm losing you guys. I can't see you, but I'm sure you guys can see me in my slides.
Yes, we can.
Perfect. Going blind. So more importantly than strength is awareness and function. And everyone's looking at the pelvic floor as, it has to be strong, strong, strong. And I actually treat a lot of pelvic floors that are overtrained. We can see this in radiation because and even post-surgically, because what will happen is the muscles will actually grip. And so can I kind of imagine that you have the muscles down at your pelvic floor are just clenched and you're saying squeeze more. Like if you go to a place that doesn't actually assess the pelvic floor musculature, which is an evaluation, feeling from the inside vaginally and sometimes rectally. So these muscles are super, super clenched and you're saying squeeze them more and they can't. So you actually have to undo that, create this awareness. What are my muscles and my connective tissue doing? And the way that you do that so great is with breathing. So we do the deep diaphragmatic breathing. You get to start to understand where the muscles are. So as you, we can all kind of do this sitting in our chair, where if you're inhaling with your hands on your tummy, you want to get a nice big belly and think of the pelvic floor dropping into your chair. So on the slide, you're inhaling, the diaphragm contracts and goes down, and then the abdomen goes out because all the abdominal contents will bulge wherever there's soft tissue. So there's soft tissue here abdominally and soft tissue at the pelvic floor. So this is the best way to really have this awareness, and you have to have length and you have to have function prior to even training these muscles. Because again, if you're coming in and you're super clenched and someone's telling you to squeeze them more, you're going to actually create more issues. You're going to have more pain, more dysfunction. So really super important to.
So it's not all about Kegels.
No, let me show you. I love showing everyone. Can you see the man?
Yes.
That's Arnold Kegel. His name is actually Kegel, which is pretty funny.
Cool. Okay.
I want to find him and I want to find his family. And someday I hope it gets to them that want to be like, what do you think about your grandfather's name being used? So this was a dude, he was a surgeon in Chicago in the 1930s, and he lost his fine motor. Small little history lesson, because I just find this so fascinating, right? Because the Kegel or Kugel is this elusive thing that everyone has to do to make their pelvic floor right, and nobody's really doing it correctly. So whatever, a little bit of shame there, blaming, I think. So back to Kegel. He was a surgeon here in Chicago. He lost his fine motor, so he went to Chicago. He went out to California. All doctors in California become famous. So he went out to California and started catching babies and working in an OB-GYN clinic. And he started noticing that there were weak muscles after deliveries, and created the first biofeedback. The pyranometer, it's a first biofeedback unit. And he's the one who kind of is behind these Kegels. And I don't teach them, to be blunt.
Oh.
So we do breathing, and we have to be, so many people, if you're to do a Kegel, a lot of people will hold their breath and push, and that makes everyone worse. And that's something that no one's really talking about. So doing that breath work, and then if I do want to do the breath work so patients can understand that there is this pelvic floor. We do a lot of I'll direct patients on how to feel their different muscles from the outside. If they, it's really actually difficult for patients to feel their muscles completely from the inside. But it's really open and patient directed as to whatever the patients, when they're coming in, how big or little they want to work on this area. So with the breathing, we get that nice big inhale, the pelvic floor elongates. On the exhale, there's a gentle recoil. And at that point, I'll kind of talk about kind of bringing a marble up and into the vagina, or kind of holding in gas to pull in the pelvic floor. And then that relaxes back down. So we know that if there's breath holding, or if someone's not relaxing well, or there's increased pain, those are all signs that the pelvic floor musculature is not, it's not performing how we want it to perform.
Interesting. Okay, so think marbles, really, the breathing and the marbles. I love your emphasis on breathing because I think it definitely pulls it. It puts the focus more on that act as opposed to the actual act of squeezing or pushing or doing whatever you're doing with your actual pelvic floor. But with the breathing, you're still activating all the important stuff that needs to for that therapeutic part of it. Plus, this is a whole other Cervivor chat, and I know this is a passion of yours too. With the breathing, you get all that mindfulness part too. So it's a great way to kind of, like, you're working your pelvic floor, but you're also working your mind.
You can do it anywhere, right? You could totally be like, oh, I'm working my pelvic floor right now. Nobody knows.
That's awesome. Okay, so really the breathing part, you're saying, is one of the best things that we can do for our pelvic floor as cancer patients and survivors, and really just as women in general. I know that speaks to that population as well. Any other tips or exercises before we move on to lymphedema?
I love whatever patients are passionate about. So I will support them in a walking program, in yoga, running. I only run from like wild animals chasing me. So running's a little bit difficult for me personally, but whatever my patient wants to get back to, I feel like it's my job to find ways to get them active. So find what you love and then really build on that, and break it down to little parts, and then maybe work with a therapist, maybe on your own. Just try to increase that activity level and whatever physical activity that the patient loves.
I think that speaks to, I guess, because as a patient, whenever I think of physical therapy, I think of it's very prescribed, and like I'm coming in with this one ailment, whatever it may be, and then there's this very prescribed approach to helping me or to fix that or to rehabilitate and whatnot. And so I love what you said about how you kind of differentiate the approach and the care that you give to people who might have similar issues coming in based on what their preferences might be or their lifestyle. And I think it's important for our community to know that with regards to physical therapy, like that can happen. Like your physical therapy can be tailored to you to some degree, which I think is an important part of empowering, as a patient and a survivor, empowering yourself to knowing that physical therapy can really be tailored to you. And that's something that I have never known or even thought about before.
Sure.
That's awesome. Okay, let's move into lymphedema. So lymphedema, I know, is something that, like, again, I said it before, but as a patient and a survivor, I did not know what lymphedema was. I never heard about it until probably about a year or two after my treatment ended up, and I noticed some swelling in my leg and in my ankle that, triggered me to go to the doctor. And then, the sequence of events kind of fell with regards to physical therapy and, the quote unquote diagnosis of it. But I feel like it's a very common side effect of cervical cancer treatment. We see it a lot in our attendees and in our community, a lot of women with lymphedema or with the symptoms of it, and they might not even know they have it. So I'd love to hear from you about just what is lymphedema. So just kind of define it and explain it in a pretty basic way as much as possible. What is lymphedema? And then how do we care for ourselves if we have it?
Absolutely. So the lymphatics is a system. I love underdogs. It's a total underdog. No, I should actually bring in a picture of the lymphatic system. Kind of funny, but I would really love to get into the screen part of this. But anyways, I can't see you again. Going blind. So lymphedema is an issue with your lymphatic system. Your lymphatics travel along all of your arteries and veins, and they pick up large particles, whatever the veins can't pick up, which is about 10%. So arteries bring the blood flow out from your heart to the space of the capillary bed where the oxygen, carbon dioxide change is happening. Sorry, you said simple. Arteries are bringing out blood, and the veins then pick up most of the blood. Because there can be larger particles that occur within that interstitium or that solution where where it's the capillary bed where the transport is occurring, that 10% is too large to actually come back via the veins. So it gets picked up with this lymphatic system. The lymphatic system isn't trendy. It doesn't have meds or a lot of surgeries. So there's not a lot of awareness or talk about it, to be blunt. So the lymphatic system, whenever there is an injury to it, or if you're born with an issue with your lymphatics, then lymphedema can occur. And lymphedema occurs that, I'm going to try real quickly because I have really great pictures here that are at my feet.
Oh, great.
I can't see you guys. All right. You're just going to have to direct me. Believe it or not, I have posters under my table.
Well, here, what we could maybe do is, do you feel comfortable with stopping sharing your screen?
Yes.
Because then we can see you.
Well, I can't. Oh, there it is. Stop share. Okay, I can see me. Can you see me? Or no?
Yes.
Stop the share though, right? You share?
I can see you, but let me look.
Because usually if I go down to the bottom, it'll give me the options
to stop sharing your screen.
There we go.
Yeah.
Can you see?
Did you click stop share?
Stop share. I paused it. There we go.
There we go.
All right. There's posters that I have underneath my table.
I love it.
So this is your lymphatic system. And there's two main systems. There is the superficial and deep. So most of the treatment that is talked about is the superficial treatment. I really like, so this just shows the green goes along the red and the blue, which are the arteries and the veins. Super, super important. 10% of what gets picked up from that interstitium goes to the lymphatics, and cancer cells are larger cells than what the veins can pick up, which is why they're looking for cancer in the lymph nodes. So with cervical cancer, we know that they're going to the deep pelvic nodes because that's where that area drains to. When there is an issue, this is kind of, so this one shows all of the different watersheds. So this is from a treatment perspective that we know if it's the lymph nodes on the left pelvis have been affected, either radiation and or surgery, that there's going to be swelling distally, so in that left leg. So let's go to the right leg because that's what they're showing here on this side. So we know that if there's any issue to the pelvic lymph nodes, that any area below it is going to have the opportunity for congestion and backup of this lymphatics. It's a pump overload. The lymphatics is just a pumping system. And then when it's not pumping at full efficiency, that pump has that backup. So then we start to see lymphatic fluid, and it shows up, furthest down at the foot. It usually makes its way up. It can also be genital. There can be vulvar swelling and other, it doesn't have to be this way, but usually it's precluded by that heaviness, that achiness, that tightness. And then we teach you how to do the self-massage and prescribe pumps, and we do deep breathing, which is my all-time favorite for lymphedema.
Another breathing part.
Right? Because that works the deep lymphatics. So on this one, sorry about the glare, on this one it shows the deep lymphatics. So the deep diaphragmatic breathing stimulates the deep system. So that's not what a lot of people are talking about. So like, Lauren, that's so simple. Deep breathing and belly massage can really improve anyone's lymphedema. So I just love this because it shows all the different watersheds, and it just kind of, I'd like to show to patients and be like, hey, this is what's happening. It's very real. There's just such a lack of information and knowledge here, right? It's so true.
Yeah. Well, and I think it's important too for patients and survivors to recognize that, again, it starts in that pelvic area with that pelvic node that's been, traumatized, affected by treatment, but I guess your symptoms don't necessarily show up right there. You don't quote unquote feel or see the symptoms in your pelvic area. It's usually in the leg, unless it's, the more of the pelvic piece that gets swollen. But again, how interconnected everything is, it's amazing. It's fascinating. I love your analogy of the lymphatic system as a pump system. I think that's really easy for people to understand, and it makes sense. And those of us whose lymph systems are traumatized, the pumping just isn't working as efficiently as it should. And that's where we get the swelling, or I know I have been hospitalized for not so much recently, knock on wood, but within the first probably 5 or 6 years, I was hospitalized often, and at first for very lengthy times with cellulitis, with the infection that comes, from the lymphedema complications. I've since learned how to manage that. I worked with a therapist who was able to teach me like all the self drainage, massaging, and the breathing part of it too, which has been really, really helpful. I even had to go into wearing compression hose for a few years. I haven't worn them so much now because I feel like I've kind of figured things out, but for a while I wore those compression stockings on a daily basis just to be able to try and stay on top of those infections and the swelling and whatnot. So so you have lymphedema. How do we best care for ourselves? I know you've mentioned a couple with just some of the massage that you can do, but what is the best way for people with lymphedema to practice self-care?
So it's your right to have a therapist, a certified lymphedema therapist. So definitely, if you have access, and now telehealth is going to be something that's really big. And we're also working on some like independence measuring tools. So there's going to be, I think, a lot of changes with what we're going through right now. Deep breathing, massage, compression, and then exercise with that compression on. Those are all ways to improve the pump of your lymphatics. Elevation can be helpful. There's at the end of the PowerPoint, there's a couple links to some videos. And in one of them, kind of talk about rearranging your furniture. So whenever you're lying on the couch, you've got your leg up on the back of the couch whenever you're watching TV. So change the feng shui of your living room and bedroom so that when you're watching TV or when you have your favorite reading spot or whatever you like to do when you're resting, that you can get that leg up. Let's see what else besides lymphedema. I would say really, truly seek out help locally. Call your local hospital. They usually know who and how to find that lymphedema therapist. There's websites at the end of the PowerPoint that you can go to. You can always reach out to me. We're lymphedema therapists are pretty well interconnected. So we can normally be like, oh yeah, I know so-and-so in St. Louis or wherever.
Okay, so if there are women who are watching right now and they're kind of thinking, oh my gosh, that's me, I think I have lymphedema, but nobody's really diagnosed it yet, or they're thinking, I might want to look into this, their best next step or their best first step is really to kind of search out the physical therapy piece. But, and this is something I didn't know either, any physical therapist isn't necessarily trained in the lymphedema piece, right? Like it's a special certification that you get. And so if they're going to seek out a therapist, they do need to be mindful of the fact that there are special physical therapists out there with this training.
They'll have CLT after their name. It's very proud because it's very expensive training. So CLT will be nice and big after their name. Sometimes it has CLT LANA, so that's a registry. So either of those are great. And I have known of a few physical therapists and occupational therapists, and speech therapists can also do, they do a lot of head and neck lymphedema. I'm trained in all the areas, but so it doesn't have to just be physical therapy. It can be OT speech, also doing the work for teaching the massage. And because it's systemic, that you can actually see a speech therapist for your leg lymphedema. I know that sounds
interesting.
If they're certified in lymphedema, that they've had that training and that information. And something else that I think is really important for everyone to know is when there's been radiation or surgery and or chemo, you are stage 0 lymphedema. So I actually I don't diagnose because that's not within my scope, but I like to educate that the very second there's an injury to the lymphatic system, you're stage 0. So that means it's time to have the information and to prevent it, because it's that heaviness, that achiness, and that tightness that we're looking for to make sure that the education and the interventions are there to just before the patient gets overwhelmed.
That's huge. I'm glad you said that, because I think for me specifically, and I know for a lot of women, we don't necessarily take action until we see or feel some of those symptoms. But just knowing that if you've had that kind of treatment, you're considered stage 0. And even though you might not be seeing or feeling symptoms, there are things that you can and should be doing. And I think that also speaks to some of my main messaging for women as an ambassador and an advocate is the proactive piece to your health, right? Like, how can we be proactive with our gynecologic health, but also our overall health as well? And I think what you just said really speaks to that. Like, we can be proactive with this by knowing that we're in that stage 0 and then proactively seeking out the help or the road to treatment that could be helpful for us and keep some of those side effects even minimized. I love that.
There's an amazing study done out of Turkey and this is just, I've been waiting to say, oh my gosh, we can prevent it. Because people get really mad when I say things and they're like, no, Lauren, we can't treat it and we can't prevent it. We're only managing it. I'm like, why? Because there's I'll get off my soapbox. But back to the study in Turkey. It was a randomized clinical trial, which is the the really good one. Their numbers, they had about 70 people, which we wish there was a little bit more, but they took, this was a breast cancer lymphedema population where they took 35 patients and they did not give them information and they did not give them exercises to do. And then the other group had the education and the exercise. The group that had the education and exercise had 0 lymphedema, 0 rate.
Wow.
The group that didn't had a 60% rate of lymphedema.
Amazing. Oh my gosh.
And we're not talking about heaviness, achiness, or tightening. We're talking about a difference of 2 centimeters in circumferential. So like they're stage 2 lymphedema. They skipped stage 1 and went straight into stage 2. So that's really, really exciting. And we're working on a couple things to kind of make sure everyone has access to that information and that education, and yoga programs they could do if someone likes. Walking is really important. Just, really kind of increasing the activity that the people that are going through the cancer treatment are wanting to do. Because otherwise, I know if I were to give that specialized PT that you were talking about before, I shouldn't say specialized, that very prescribed, no one does those, right? Like, if you don't like them, you don't do them. And then you get a little resentful, like, I really don't even want to do these right now. As opposed to finding out, like, does my patient love to swim? Like, when can we get them back in water? Or whatever we can do to get that person active and feeling powerful.
But it is. Well, and I think that study kind of just speaks to the whole, this is why we do Survivor and Survivor Chats, is that whole knowledge is power, and we're so empowered when we know what the information, but then also what we can do about it. Okay, we've got to wrap this up, but man, I feel like I could talk to you for hours about this stuff, and maybe it's another Survivor Chat at another time, but gosh, thank you so much. I'm going to speak for just a couple of minutes about how our survivor community can stay connected with us. Don't forget that there are many ways that you can keep up to date on what's out there with Survivor, events that are happening, Survivor Chats that are being released, and all kinds of great stuff. Social media wise, we have Facebook, we have our community page on Facebook called Survivor, but we also have a private Facebook group for cervical cancer patients and survivors called I Am Survivor. So if you are a cervical cancer patient or survivor, seek that private group out, but we also have the community page for Survivor. On Instagram and Twitter, we are I Am Survivor, so look us that way. We also have Survivor TV on YouTube, and then our website is great. We've got lots of great, reliable, safe information on our website about HPV and cervical cancer. We also have, we list our events, our upcoming events that we've got going on. And my favorite part of the website is the stories that are on there. So many great stories of women who have been impacted by cervical cancer. And you can reach our website at survivor.org. Lauren, how about you? How can people stay connected with you, the work that you're doing, and your area of expertise?
Absolutely. So let me bring it over to my share screen. So here at the very end, and feel free to hand out the PowerPoint. So you can locate your local therapist, try your local hospital. Pelvic Rehab will have a list of pelvic therapists. So that's bowel, bladder, and sexual dysfunction. And there's a bunch of us that have also then specialized in lymphedema and oncology. So these are, sometimes it takes a few phone calls to find your person. You can also go through APTA and then LANA. LANA is specifically for lymphedema. And my emails are here. We are working on a website that will have a bunch of resources on it, just so everyone has this information. We really want to push this HAT response, that heaviness, achiness, tightness. We don't want to wait for swelling anymore. And then I do think we're going to end up in telehealth at some point, and we're even working on some of the measurement tools right now. So a lot of excitement, a lot of, we have so much technology that of course we should be able to get this information out. So May 1st is when that website should be.
Oh, awesome. Oh my gosh, so many great ways to keep in touch and to stay connected. Awesome. Awesome. Lauren, thank you so much for being with us today. I know women are going to find all of this information super helpful, and I cannot tell you how much we appreciate your time. So thank you so much for being with us today.
Thank you.
And to our Survivor community, thank you for being with us. We have lots more coming your way with regards to Survivor chats, and we look forward to getting you that information soon. Take care, everybody.